To begin, let us acknowledge that Queen's University is situated on traditional Anishinaabe and Haudenosaunee territory. We are grateful to be able to live, learn, and play on these lands. We thank the Indigenous peoples of this area for the care of this land for thousands of years, and we hope to honor and respect them as we hold our virtual event today. I'd also like to take a moment to personally thank everyone for joining today's presentation. We've had a great lineup over the course of the month. This is our 17th presentation this month. And we've had lots of people attending, and I appreciate you taking the opportunity today to also listen in on today's presentation. Our speakers this afternoon are Dr. Elizabeth Darling and Sue Faber, who will be co-presenting on Lyme disease and pregnancy, the value of research partnerships. Normally at this time, I would read their bios to give you a little bit of background, but I know Dr. Darling and Sue are going to have that covered in their presentation. So just to give you a bit of format, we're going to have Dr. Darling and Sue present, and then we will open for questions from the audience. You can send your questions in the chat box in advance or throughout the presentation. You can raise your hand icon or unmute and ask a question when the presentation is done. And hopefully today we'll be able to get to everyone's questions. We do have to cut off the presentation by 12:55. So if you do have additional questions, I know that Dr. Darling and Sue would be happy to answer them after the presentation, and I will reach out with them with your additional questions if we're not able to cover everything today. So without further ado, please help me welcome Dr. Darling and Sue to the podium.
Okay, just sharing my screen here. Okay, can you see our first slide here? We're good? Okay, let's get started. So we just want to thank the Canadian Lyme Disease Research Network and Veronica for reaching out to Lyme Hope. And it's a real honor to be here. And we're excited to share about our experiences with you today. Our talk is divided into 5 sections as we've outlined here. So we're going to kind of do our own little introduction, meet the researcher and the advocate, followed by a brief overview of Lyme disease and pregnancy. Then we're going to go into the birth of a research partnership, talk a little bit about SPORE and involving patient-oriented research into Lyme disease and pregnancy research. And we're going to conclude with the value of research partnerships, followed by a Q&A. So I'm going to hand it over to Liz to start us off with an introduction of herself.
Thanks, Sue. Hi, everyone. So my name's Liz Darling, and I am a registered midwife as well as a faculty member at McMaster University. I'm currently a scientist in the McMaster Midwifery Research Center and a member of the Department of Obstetrics and Gynecology. And I have a master's degree in epidemiology and a PhD in population health. My research has involved working on the design and statistical analysis of large population-based cohort studies, and I have expertise both in quantitative and qualitative methods. I'm also an adjunct scientist at ICES, and I'm an associate member of the Department of Health Research Methods, Evidence, and Impact at McMaster University. I'm currently investigating, or the principal investigator on a couple of CIHR-funded studies looking at midwifery services. And I also have experience in developing patient recruitment strategies for research that involves engaging with health service users, healthcare providers, key informants, and stakeholders, and in keeping these groups engaged throughout the research process. So over to you, Sue.
Okay, thank you, Liz. So my background is I am a registered nurse. I actually did my nursing degree at McMaster University. And I just want to highlight there that probably the most important part of my nursing education was problem-based learning. And really, when you identify an issue, learning to think outside of the box and figure out solutions that are going to help meet the unmet need that you've identified. So I just want to put a shout out to McMaster for really teaching me and that being ingrained within me as a nurse and would carry with me throughout my career and also in my personal life. I'm co-founder and president of Lyme Hope. We are a Canadian not-for-profit organization. And our real interest is in maternal fetal transmission of Lyme disease. My area of expertise actually lies in the compilation and analysis of the literature on maternal fetal transmission and on congenital Lyme. And my goals are to amplify, support, and power research initiatives to investigate this important understudied issue. Ultimately, we need new research partnerships and collaborations within government and academia, which include, respect, and prioritize patient voice, values, and preferences. A little bit more about me. I did receive a fellowship award through the Registered Nurses Association of Ontario. Last year, I was honored to be invited to the US Tick-borne disease working group, to a subcommittee. And one of the areas that we looked at was Lyme and pregnancy, and I did present to the subcommittee on the issue as well. And then most recently, Liz and I are organizing committee members for an upcoming Banbury meeting on perinatal transmission of Lyme disease, which will be held at Cold Spring Harbor Laboratory in New York.
So we're going to start the next section by Sue providing us with an overview of some of the research studies that have identified findings of maternal fetal transmission of Lyme and congenital Lyme disease. And I just want to acknowledge that research in this area is limited and that significant research and knowledge gaps still remain. More recently, governmental institutions in both the US and Canada have acknowledged this issue, and furthermore, they've identified the need for more high quality evidence in this area. And this certainly sets the stage for new research opportunities and opportunities for collaborations in this field.
Okay, so I'm just going to do a brief overview here of Lyme disease in pregnancy and some of the evidence that exists around this, around maternal fetal transmission. Both the US CDC and Health Canada acknowledge on their respective websites that Borrelia burgdorferi, the agent of Lyme disease, can be transmitted across the placenta and infect the baby. It is thought that this alternate mode of transmission is rare. However, the incidence and prevalence of both gestational Lyme, that's a mother with Lyme disease in her pregnancy, and congenital Lyme infection, which would be a baby who would be born with the infection, is unknown and understudied. New intensive research and investigation will better clarify the current incidence and prevalence of this alternate mode of transmission. If we look at surveillance numbers of new cases of Lyme disease in the US and Canada, what we see is that the US CDC estimates just under 500,000 new cases of Lyme disease per year. In Canada, PHAC reports a preliminary count of just under 3,000 cases in 2021 and also acknowledges underreporting. In both countries, there is no epidemiologic mechanism to track cases of gestational or congenital Lyme disease. It's currently unknown what proportion of Lyme disease diagnosis may occur in pregnant persons and to what extent their pregnancy or developing baby may be affected. And this poses a significant knowledge gap. The current or 8th edition of Remington and Klein, Infectious Diseases of the Fetus and Newborn Infant, is an authoritative medical reference textbook on congenital infection. Authors in the first chapter recommend expanding the well-known acronym TORCH, which identifies microorganisms known to cross the placenta, to TORCH's CLAP, with L representing Lyme disease, which I've highlighted in yellow. In a separate table, they highlight that Borrelia burgdorferi can result in congenital disease. There are 24 separate publications documenting primary cases of maternal fetal transmission to the fetus or baby or infection of the placenta. 21 cases whereby Borrelia burgdorferi is identified upon autopsy from neonatal death, stillbirth, and miscarriage, 16 cases of live birth, neonatal infection, and adverse outcomes, and 22 cases, a majority where the mothers were treated for Lyme in their pregnancy, where Borrelia burgdorferi is identified in placenta. A detailed description and citations for all these cases can be found on our Lyme Hope website under the Research tab. If you combine findings from all cases in which Borrelia burgdorferi was identified in fetal, infant, or child tissue, as well as placenta, it is clear that hematogenous spread of the spirochete in pregnancy can result in widespread dissemination. I've highlighted in yellow fetal organs in which Borrelia burgdorferi has been cultured, including kidney, liver, and brain. I've highlighted in blue cases where Borrelia burgdorferi was identified by PCR in fetal tissue, cord blood, breast milk, infant skin, and placenta. Lastly, I draw your attention to the area highlighted in green, which identifies 2 cases where where Borrelia burgdorferi specific antibody was detected in infant cerebrospinal fluid of symptomatic infants. Vertical transmission of Borrelia burgdorferi has also been studied in both natural animal populations and in experimental studies, and subsequently documented in mice, rats, cows, horses, dogs, foxes, and coyotes. And again, citations and more complete descriptions of this can be found on our website. Limited research findings suggest that acute Lyme infection may be attenuated or diminished in pregnancy, which has been shown in pregnant mice infected with Borrelia burgdorferi compared to non-pregnant mice. And similar findings have also been found for relapsing fever Borrelia. A 2020 study by authors from Slovenia identified that the clinical course of early Lyme during pregnancy was milder in pregnant versus non-pregnant women. Obviously, identifying pregnant persons with infection is of critical importance, and there are published studies whereby the mother was asymptomatic and had no recall of a tick bite or other subjective symptoms, such as an erythema migrans rash. The 4th and 5th edition of Remington and Klein, Infectious Diseases of the Fetus and Newborn Infant, chapter on Lyme disease provides valuable insights and probably the most detailed overview and comprehensive data analysis on the subject matter of gestational Lyme and congenital Lyme up until 2001, when the 5th edition was published. The author, an infectious disease pediatrician, identified 66 cases with adverse events associated with gestational Lyme borreliosis. And this table highlights the frequency of fetal or neonatal adverse outcomes after gestational Lyme, including miscarriage, stillbirth, perinatal death, congenital anomalies, systemic illness, early onset fulminant sepsis, later onset chronic progressive symptoms. A heterogeneous range of adverse outcomes reported with gestational Lyme has been reported, but a specific phenotype or congenital syndrome to identify Lyme infection has not been identified. What is known is that prompt treatment in pregnancy is correlated with fewer adverse outcomes, as can be seen across these 4 studies. A systematic review on the impact of gestational Lyme conducted by PHAC and a collaborator from the CDC identified that treatment is associated with good outcomes compared to non-treatment, and that untreated pregnancies resulted in a 50% rate of adverse outcomes as compared to 11% in treated cases. A 2020 publication from Slovenia with patients treated for erythema migrans rash in pregnancy reported 13.8% of this cohort experienced adverse outcomes, which included preterm birth, fetal and perinatal death, and congenital anomalies. But again, no specific pattern of anomalies was noted. In the case with adverse outcomes, placentas, fetal tissues, and offspring were not tested for Lyme with direct detection methods, and it is uncertain if these were related to borrelial involvement or other reasons. One other important area that needs further study is identifying the best treatment regimen in pregnancy, which not only treats the infection and prevents long-term sequelae in the mother, but also eliminates the infection so as to prevent congenital transmission to the fetus. These little flags are my attempt to represent research findings related to Lyme disease in pregnancy. As you can see, the blue flags represent North American research, and the yellow flags represent findings from Europe. And there's a couple findings from Russia. The area I've highlighted in green represents over 20 years whereby there has been no research in this particular field in North America. We urgently need to bridge this gap, especially with increasing prevalence of new cases of Lyme disease rising in North America and globally. Over the years, many researchers and investigators have identified the importance of conducting prospective longitudinal investigations of pregnant women with Lyme disease and their offspring. This is a huge research gap, as such studies have not yet been carried out within North America, and there's almost no longitudinal data on infants born to mothers with a Lyme disease diagnosis. According to Dr. Gardner, who I referenced earlier, I quote, "Determination of true risk to the fetus and infant of maternal gestational Lyme disease requires prospective studies of all pregnancy outcomes of gestational Lyme disease, long-term follow-up of live-born products, these pregnancies, and improved diagnosis of Lyme disease in affected fetuses, placentas, and infants." There is momentum in this area in the US, with the formation of the US Tick-Borne Disease Working Group, a federal advisory committee related to tick-borne diseases. A 2020 report to Congress identified the necessity for further evaluation of non-tick bite transmission of Lyme disease, for example, maternal fetal transmission. And as I mentioned earlier, I was honored to receive an invitation to participate as a subcommittee member for the third iteration of the working group. And one of the priority areas we specifically addressed was Lyme disease in pregnancy. I'm thankful that there's a collective interest and collaborative opportunities in this area within government agencies and academia, which welcome and incorporate patient engagement. So now we are going to go on to the birth of a research partnership. So over to you, Liz.
Yeah, so we're switching gears a little bit now, and we're going to talk about the birth of our research partnership. And I guess compared to many patient researcher partnerships, ours may be a little bit atypical in that it was initiated by Sue as a patient advocate rather than by me as a researcher.
And it was interesting how we met. I had attended a workshop at McMaster on systematic reviews. And during the workshop, I had shared my interest in the issue and field of maternal fetal transmission of Lyme disease with my fellow attendees. And one of the attendees at the end followed up with me and ended up introducing me to Liz.
So our first conversation was really about all of the issues that Sue felt needed research. And I was really compelled by the questions that she was asking based on my own experience as a midwife caring for clients who had had Lyme disease. And so, oh, sorry, I think that's over to you next, Sue. Oh, sorry, no, sorry. So Sue had originally come to me for guidance and support around the idea of conducting a systematic review on Lyme disease and pregnancy. But as our conversations unfolded, we realized that there were some other research questions that we could collaborate on.
It was a breath of fresh air to meet Liz. First of all, she's an incredible individual and researcher. And I just can't say enough of how welcoming she was. And that really meant a lot to me. And in turn, I believe that means a great deal to the patient community. So I felt that my concerns were being listened to, and the groundwork that I had done up to that point was being acknowledged as valuable. Liz listened, and she was very thoughtful with ideas and a way forward.
So as Sue's already highlighted, I think one of the key gaps in this area is the need for prospective Lyme disease research looking at Lyme in pregnancy. But after our conversation, we identified two projects that we wanted to work on, which might be stepping stones towards that. So the first was a survey of people who had experienced Lyme disease in pregnancy. And the second was focus groups with some of the survey participants. So we put together a multidisciplinary research team that included both clinician and basic science researchers. And then Sue provided really important feedback to us as we developed questions for the survey. And she also helped to connect us with a small group of individuals who'd been impacted by Lyme, who helped us with piloting the survey before it was actually launched. And then she played a really big role in helping us to connect with organizations that helped us to recruit patients.
It was a privilege to be able to reach out to Lyme disease organizations and advocacy groups and ask them to share this research opportunity with their members. Having a trusting relationship with Liz as the primary investigator gave me full assurance and confidence, knowing that patient input and participation in the research would be valued and respected.
So we're not going to talk about research findings today, but the results from this study have been analyzed, and we're currently preparing a manuscript for publication. As Sue mentioned, we also conducted focus groups with some of the survey participants, and the main objective of that research was to identify what they saw as being research priorities in this area, and also to explore a little bit more some of the issues around the feasibility of conducting a prospective cohort study of Lyme disease in pregnancy. And we've also analyzed these findings and are preparing them for publication. And this input has been immensely valuable in laying the groundwork for future studies.
I just want to add that for patients to be invited and their contributions and ideas valued as part of a research team is so significant. And I believe that this will open more doors to similar opportunities within other areas, perhaps, in the field of Lyme disease.
So our experience is really an example of what's actually been emphasized by the Canadian Institutes for Health Research, or CIHR, in its strategy for patient-oriented research. So we're now going to talk to you about some of the more general benefits of patient-oriented research and patient engagement.
Canada's Strategy for Patient-Oriented Research, or SPORE, is a framework which was developed with contributions from patient representatives and patient engagement experts who participated in the SPORE Patient Engagement Consultation Workshop on January 9th of 2014. First of all, the goal of patient-oriented research is multifold. And as you can read on the screen, it's to actively collaborate together to build a sustainable, accessible, and equitable healthcare system, to improve the relevance of the research for patients, to improve the quality of the life of Canadians and result in a strengthened Canadian healthcare system and services. And also what I've highlighted in yellow, so important, that patients must be involved as much and as meaningfully as possible in order for health research to be more responsive to their needs.
And this is just to highlight that the importance of patient-relevant clinical research has also been highlighted by the editor of the CMHA.
And I just want to point out one thing that she says here, which is just so important. I'm going to read it out. It's so important to me, and I also believe to the Lyme patient community, that for patient-relevant research to be meaningful, patient and public engagement in research cannot comprise a token lay person on a research ethics review board. Patients and their caregivers must be involved in decision-making at all steps in the research process, from design to choice of primary and secondary outcomes through dissemination and implementation. And I believe that is something that Liz and I have worked really hard on together with the work that we've done so far. So what can patients and advocates contribute to research? Why do you as researchers want us on your team? Well, there's many reasons for that. So I'm just going to put a shout out to patients and advocates because they are experts. They are experts because they have lived experience with the illness that they have suffered with. In many cases, it's been a very long battle. They have knowledge that they've gained through navigating the complexities of an illness, of their illness. They have personal experiences. There's been good and there's been bad with treatments in the healthcare system, and not just treatment modalities, but also how patients have been treated within the healthcare system. Patients have unique perspectives and ideas, and they are brilliant. They are brilliant. They are so motivated to come up with ideas and solutions, which will contribute to effective change and make things not only better for themselves, but also for others. So I just really, really encourage researchers to reach out and say, hey, we want to work with you, and let's form a partnership, just as what has happened with Liz and myself.
Just to echo what Sue said, I think when we conducted our focus groups, we really found that there were lots of really excellent ideas coming from the people that participated in those about what kind of research might be useful to do in this area. So to meaningfully involve patients involves more than just reaching out after you've written a grant to try and add them to your team. Really, you want to be starting off by having patients involved in the conception stage of the project. So including them as research committee members in the planning, designing, and guiding the project as it progresses. And this involvement in decision-making processes and in bringing forward priority areas for research is really integral to patient-oriented research. The other thing is also that meaningfully involving patients can also include helping them to build and develop skills so that they can become competent, and helping them to master specific research skills, learning how to engage with other patients, how to capture and articulate their ideas, how to support these ideas with valid research, and how to bring them to the table. They're also really valuable, as we've mentioned a couple of times already, in identifying what are really the right research questions to be asking, in contributing to choosing the right study design, especially helping with recruitment. They can also be involved in data collection and in analyzing or interpreting the findings. And patients really also can have a role in reviewing stories to identify common threads and relevant themes that arise in their experiences. And this really helps to ensure that the outcomes that you're looking at in your research are going to be ones that are supported by patients and that get measured. And also as supporters of participant-friendly research studies, it's really important to improve access to patients through peer networks and by helping to access difficult to reach patients and groups. And I think this is one of the key things that we found in the survey that we conducted, just that having a knowledgeable patient partner as part of that project really helped with us being able to access people who were willing to participate and contribute to the research.
So I just love this picture of this, yeah, what is it? It's a rope, but it's a cord that has multi facets to it, different cords tied together, working together, collaborating together. And as a patient, and based on my experience to date as an advocate, but also as an expert in the field of Lyme disease and pregnancy, here are some ideas that are important for effective patient engagement, just tacking on to what Liz has just shared. Embracing patients as a critical part of a research team, from inception to completion, publication, and information dissemination. Inclusion of patient advocates as a critical part of a planning team for guideline development, for example, at seminars, conferences, grand rounds, and think tanks. And that kind of tags on to the next point is having patient testimonials at seminars, conferences, grand rounds, and think tanks. This is really important. If you're going to be meeting with, let's say, your hospital or with a group and talking about Lyme disease, invite patient organizations to come. And leaders of those organizations would have patients that are effective in sharing their story and articulating some of the things that have been challenges for them. And they will be an incredible addition to your meeting. And I just really believe that, there might be dissonance in what these patients are sharing, but dissonance always opens new conversations, discussion, and solutions. And I think it's really important to recognize that Lyme disease patients historically have felt left out of these types of meetings, and they have been left out in many examples. And it's time for us to welcome them back in and respect what they have to say and work with them to improve everything within the medical system related to Lyme disease. And then, of course, it's really important to have patients who've contributed significantly to be co-authors of papers or publications, and as well as acknowledgement of any participation in your paper or conference proceedings. So these are guiding principles of integrating patient engagement into research, and Liz will review each in more depth. So we're going to start off with inclusiveness.
And I think these expand on some of the things that we've been talking about already. But when we think about inclusiveness, this really calls on us as researchers to think about integrating a diversity of patient perspectives. So not just, potentially turning to the patient advocate who is the most well-versed and, maybe has a background as a healthcare provider, but also including other voices as well, and trying to support the involvement of people who may be less comfortable or have less ease in terms of interfacing with researchers, and really trying to adapt the ways in which you work and organize things to support their active participation and make sure that their voices can be heard. So that sort of ties into the next piece, which is the idea of support. So providing adequate support and flexibility is really essential to making sure that patient partners are able to be active participants in the research, setting things up in ways so that people can be oriented to projects so that they feel comfortable to fully contribute to discussions and decisions, and working on creating a safe environment that promotes people to feel comfortable providing honest interactions, making sure that there's cultural competence and training and education provided to the research team to support that. And also providing support implies that there are mechanisms for compensating people financially for their time.
And I would just reiterate, a safe environment for patients means that patients can speak out about their experiences without feeling judged or misunderstood. And this is really important. And I just feel like this has been a real example of working with Liz and with the work that we've done so far, as we have created that safe environment and a place where those who interact have really appreciated that safe place. So I'm going to talk a little bit about mutual respect. Researchers, practitioners, and patients acknowledge and value each other's expertise and experiential knowledge. As I'm sure many of you know on this call, Lyme disease is a disease which has unfortunately been mired with much controversy and uncertainty, which has been detrimental to the field in general. There's been a great deal of neglect, pain, marginalization, and suffering endured by Lyme sufferers for decades. And many feel that their voices and concerns have been muted or ignored. It is time that those impacted by Lyme disease are respected, listened to, and welcomed into all aspects of government policy, research design, guideline development, and decision-making around the disease which they live with. Mutual respect goes both ways. There's great power and momentum in collaborative research, whereby foundational pillars of respect and trust are shared and enacted upon by researchers and patient collaborators. I was recently in a meeting where the point was brought up about just the controversy in the field of Lyme disease research. And an individual said that this should not serve to further divide, but rather anchor collaborative research efforts and initiatives. And I believe this is exactly what is needed to better understand Lyme disease in pregnancy and congenital infection. And I really am hopeful and excited for what the future holds as we move forward in this area.
So we've also mentioned this, I think, already, but I think one of the other really key principles is that for truly meaningful patient engagement in research, we need to use a co-build process where patients and researchers and practitioners are working together from the beginning to identify problems and gaps, to set priorities for research, and then to work together to actually conduct the research and interpret data and implement solutions that arise from the research. And I think one of the really important things if we do approach research in this way is that it opens doors in both directions, I think. So, I think as we pointed out on the last slide, mutual respect is a really important part of successful partnerships. And I think, especially when there is controversy, really engaging people actively from the beginning is helpful in making sure that everybody's confident and about the outcomes of the research. And it helps to make sure that everybody's needs are met.
So we've made it to our last slide here, and I just love this image. I just think it's so perfect. Just the value of research partnerships. This is a beautiful example of collaborative partnerships, whereby researchers in academia reach out and offer their expertise. And in turn, so that's one branch moving over, and in turn, patients are welcomed into the process and reciprocate by sharing their lived experience, providing valuable insight, identifying new priorities to guide research and perspectives, which in turn increase research quality. Working together, building trust, listening and engaging can result in effective bridge building. The product of such collaboration is multifold, but can result in new growth, as depicted by the tree in the middle. And this is just something that I believe can be a model for all research on Lyme disease. I know there's so many multifaceted areas that research is ongoing. So thank you for listening to our presentation as we kind of reviewed a number of different things. I just want to highlight that I know I brought up some of the research on Lyme disease in pregnancy and maternal fetal transmission in both humans and animals. All of that information is readily available on our Lyme Hope website, and you can download documentation, which will clearly give you all the citations that you might need and more information. So I think we're now at the point of having some opportunity for questions. So I will stop my slide share at this point.
Thank you so much, Sue and Dr. Darling, for your engaging presentation. I think we could have had a better presentation to end this month for Lyme disease awareness event. It's an important topic. It's embedded in our nature of our network, in your research at McMaster, as well as with Lyme Hope. And I think, this is just the start of many conversations collectively in partnership with our patient partners and family caregivers for us to continue when it comes to Lyme disease and other tick-borne illnesses. We do have time for questions from the audience. I'm just looking to see. There isn't an actual question yet in our chat box. We do have one question. Very interested in hearing about your results. Can you give us a little insight of what's to come, perhaps?
Maybe just very briefly, very high level. So in our survey, we included participants who had had Lyme disease in pregnancy with no restrictions looking back in terms of how far in the past that had occurred. And we also included participants who hadn't had Lyme disease. So there definitely are, some big limitations in terms of the quality of that data, but really we were approaching it mainly for hypothesis generation. And when we've analyzed the data, which was a bit tricky because there's lots of sort of different combinations of when people acquired Lyme disease, when they were diagnosed or treated, and when they became pregnant. But we definitely have seen a dose response sort of effect in terms of people having Lyme in pregnancy that was untreated being associated with the highest level of complications in pregnancy and adverse health outcomes in children. And then sort of a slightly attenuated effect in people who had Lyme in pregnancy but had been treated when we compared those to the group of people who had never had Lyme disease or hadn't had Lyme in that pregnancy. So definitely some really interesting findings that will be, important to test with higher quality research that's prospective. Oh, I think you're muted.
Sorry, yes, thank you. We have a couple of questions and we have also someone who has raised their hand. So I'm going to read the next two questions, and then I'm going to go to Dr. Bordeaux afterwards for the third question. Moving forward, do you think that working alongside patients and including them as experts will have impacts beyond the field of Lyme disease study?
Sue, do you want to take a first stab at answering that one?
Yeah, I think absolutely. I mean, patients, don't forget that patients have experienced whatever the situation or illness that they have gone through, whatever context that is. But we come to the table with life experience, with our background, different sets of training and expertise. We have so much to bring to the table. And so absolutely, bringing patients in, having them a part of the research team, we're not scary, I promise, we're very nice. And we can add, we can help, we can brainstorm. I recognize, I'll be the first to recognize that Liz is the expert in qualitative and quantitative research data analysis collection. I leave that to her. That is not my area of expertise. I have a different area of expertise, which I bring to the table. And when we come together, great things happen. And I think so the same thing could absolutely be emulated in all kinds of research throughout healthcare, for sure.
Thank you, Sue. The next question, it's in the chat box, is what kind of complications in pregnancy did you find?
I'm just trying to pull up our manuscript because I don't remember everything off the top of my head. We asked about a pretty wide range of symptoms. And there were, so some of the common pregnancy complications were pretty similar across all groups. So preeclampsia and gestational hypertension were pretty similar across all groups. But some of the things in pregnancy that were more likely were for people to experience extreme fatigue or to have fevers of unknown origin, have exacerbations of joint pain. So those were a few of the findings.
Thank you. I'm going to move over to Dr. Bordeaux for his question, and then I'll move back to the chat box for the remaining questions.
Okay, yeah, thanks very much, and a wonderful talk. Really enjoyed it. Reminded me of an article I just read recently in the New York Times where a doctor who had COVID and was suffering from long COVID, and they were talking about how her colleagues were not really acknowledging her experience and were skeptical that long COVID was even a thing. So I guess we just do this again and again. But I was wondering, Sue, you mentioned earlier about all the models, the animal models. Do you think there's still a role for animal model research in this question of gestational Lyme disease? I mean, the mice, I guess, are pretty different from humans, obviously, in other ways. So do you think there's still a role there? And what would you say are some unanswered questions there?
Absolutely, huge role, because the animals can give us greater granularity around everything from, immune function, serological response in offspring, can monitor the mother over time serologically to see if there are variations in antibody response to infection. I mean, there's so many areas, I think, within the animal model field that could give us better clarity on what is going on with humans. I think one of the animal models I'd be really interested in is a non-human primate model as well, because there's just much more, I think, similarity to humans in that model. And it's also been tested, I believe, in Zika and in some other congenital infections with great success. So absolutely, really important. And I think the piece that I found that was really interesting was transmission was found not just in mice, and there were some studies that transmission was not identified in mice. I think there were 4 or 5 studies where vertical transmission was not identified or was not found. And then there were other studies where it was. So the question is, how often does this happen?
Right.
Will this give us perhaps a little bit more understanding around just the prevalence and incidence of, is it possibly is it more likely that spirochete be transmitted in acute infection versus, let's say, a latent or a chronic stage infection? These are all questions I think that animal models can give us better clarity around.
Yeah, and I think now with Borrelia miyamotoi, right? I think that one has, I mean, that's been around for a while now, but I think they're finding that one has pretty high levels of neonatal transmission. It's a bit of a different, this relapsing fever.
Yeah, and relapsing fever is readily accepted, right? That it can be transmitted vertically.
Right.
Lyme disease, it's a bit trickier, but if you dig, you can find these studies, and they're really interesting. There's cows, there's studies in natural populations of cows, in horses, in experimental studies with dogs, in natural populations of coyotes and foxes.
Right.
So I think this is definitely an area which would welcome more research by experts who have, the ability to carry that out.
Great, thanks very much.
Thank you, Dr. Bordeaux. Our next question comes from the chat box. Thank you for the great presentation. Sue, what are the 2 foundational pillars that are necessary? I believe you said one was mutual respect.
Okay, yes. So I'm just going to refer back to my notes. But what I had shared was that, let's see, respect and trust. Because you can respect somebody but not trust them, I think perhaps they both start to come together, but trusting an individual and respecting them at the same time. I think once you have those two pieces together, you have a really powerful opportunity to move things forward.
Thank you. We have a comment from the audience. This is just a follow-up for an additional question. It was super refreshing to hear someone count the patients as experts too, exclamation mark. As someone with ADHD and having dealt with a variety of physicians about it, I've recognized that the patients are the experts. Thank you. And then we do have a question, another question. Were there Canadian studies that were ignored when the Public Health Agency of Canada decided to have WHO reserve their decision about maternal transmission? How many Canadian studies? If you know the answer.
I don't have an answer for that. I'm sorry. I don't have any further information that can clarify that. And perhaps
I don't think there are
yeah,
many Canadian studies that have been done at all, though, Sue. Are there any that you're aware of?
I'm not aware of any Canadian research specific to Lyme disease and pregnancy. No.
Yeah.
Thank you
So
for
I
the
think we have,
clarification.
yeah, I think we have a big gap there in terms of Canadian specific research.
And that's
Thank
where I
you.
think that Canada can lead the way. You know, I have brought this forward to colleagues at the Public Health Agency of Canada and also the research. I said, hey, Canada has led the way in so many areas of exciting research throughout the decades. And I really think that we could do something similar with Lyme disease and pregnancy. We certainly have the expertise, the knowledge, and patients who are willing to engage. So.
Thank you. I'm just looking. We have a couple minutes left before we need to wrap up. If anybody else has any additional questions, feel free to include them in the chat box or raise your hand icon, or you can unmute and ask your question directly. Just checking to see. Oh, I think I hear something maybe. No,
It might be it might be the person cutting my grass outside, but
maybe I thought I heard a click that somebody was unmuting. So I'm just scrolling down if I see any microphones unmuted. Well, that looks like that's the end of our questions for today. I do want to personally thank you, Sue and Liz, for taking the time to talk to us today, to again enforce the importance of building our relationships and partnerships with our patient partners and family caregivers and our community stakeholders. We have a lot to do when it comes to Lyme disease and tick-borne, but I think if you peel back the onion, as I say, we all have a common core interest and goal that is moving in the right direction. And we just need to have those active conversations and be trusting and respecting and just having the conversation, I think, is important. So again, thank you so much for helping us wrap up our Lyme disease awareness event this month. I'm just going to share my screen with everybody. So if you recall, we had a little contest, hoping that everybody would participate to help raise awareness. People could send in photos wearing green or green face masks or drawings that represent Lyme disease. We did have 6 entries that did submit entries in. And instead of just picking 4 of the 6, I've decided to award all 6 of them a $25 e-gift card to Starbucks. So I'm going to share my screen. And if you can see it okay, these are, I'm just going to fix it so you can see it. These are, wrong screen. These are our draw winners. We have Matthew, Stefan, Jamie, Andrew, Terry, and Mary Lee, who all submitted an entry. And it's great to see them all in green or drawings of Lyme Disease Awareness Month. And you all are winning a $25 e-gift card to Starbucks. I will be reaching out to you to make arrangements to get that e-gift card sent to you online. So again, thank you for your submissions. Thank you, everybody, for attending today's session. Thank you, Sue and Liz, for your inspiring talk. And I see that's echoed by a lot of people as well. So thank you again, everybody. If you want to catch any of the recordings from the past month that you've missed out, feel free to reach out to me. They are behind our members portal. If you do not have a user account, just reach out to me and I'll walk you through the steps to get set up. And again, thank you everybody for attending today. Thank you, Liz and Sue, and hope everybody has a great rest of their day and rest of their week. And hopefully catch you next year when we have a new set of speakers that will be presenting for Lyme disease awareness event. And I do want to recognize and acknowledge Terry Wainwright, who's on the call, who helped organize this event this month with me and helping to recommend some of our presenters for the event. So take care, everybody, and we'll chat soon.